So in section 3, we're going to discuss the impact of hearing loss, the client's communication mode, working with an interpreter, and just things to remember. So when you are working with a sign language interpreter, make sure that you have a consistent interpreter if at all possible. This will give you the best positive progress for your client. Some of the ways to do that is if you do not have staff sign language interpreters in your organization or in your therapeutic office, when you contact an interpreting agency, let them know that it is for a mental health appointment and let them know that if they could send the same interpreter for each subsequent appointment, that would be the most valuable to the client. Also, make sure that the qualifications of the interpreter match the client's needs and the services being provided. The interpreter should be certified by the state of Texas or have national certification. In addition to that, they need mental health experience. So when the interpreter arrives, you can ask just some general questions if they have any mental health experience, or when you're going through the sessions, if the client consistently is not answering the questions correctly, or if there seems to be a breakdown or miscommunication, then you can have a conversation with the interpreter and then provide that feedback to their supervisor or their agency if there is a problem. Also, confidentiality is something that also has to be considered. Most of the time in the mental health field, we do not share information about the client with someone else that is not on the staff or part of that patient or client's team. As a sign language interpreter coming into a mental health appointment or mental health setting, some general information is able to be shared. They also have to follow confidentiality standards and code of ethics, so they also are bound to keep any information that is shared throughout the appointment confidential and not share that information with anyone. Giving general information about the client or services to be provided will assist the interpreter in providing a better message and therefore provide the client with the quality of service that is needed. Also, consider the role of the interpreter in a mental health setting. They are there to facilitate communication. So when you are talking to the client and using an interpreter, they will make sure that the message is understood in sign language, and then when the person is responding in sign language, they will voice to you what the person is saying. They are not there to assist in any way, provide any medical services or any other psychiatric services. They are just there to facilitate communication and make sure the message is communicated from the hearing person to the deaf client. Make sure that you address the client directly. So don't say things like tell him or tell her when you're addressing the client and telling the interpreter, tell him I said this or tell him I that or ask them this question. You look at the deaf or hard of hearing client directly and you just talk like you're having a conversation, and then the interpreter will facilitate the communication, interpret your message, and it will flow smoothly. Also, just remember to also allow for processing and wait time while the message is being interpreted. So let's think about and talk about a little bit about the impact of hearing loss. So understanding the different levels of hearing loss, such as prelingual deaf, hard of hearing, and latent deaf, are things that you should consider. Terms like prelingual deaf means that the person lost their hearing either when they were born or before language was acquired, usually between 0 to age 5. Hard of hearing means that the person is not profoundly deaf, but they have some level of hearing loss, although that is a wide range, and you need to ask the client not necessarily what their hearing loss is, but how they like to be identified and what they can understand in a spoken message and what they feel comfortable with. Also, the age that the hearing loss occurred is also important. When you ask that question, you can just say, were you born deaf, or were you born hard of hearing, or did you lose your hearing later? This will kind of let you know if that person had the opportunity to acquire language or if they did not. And then, as we talked about before, language acquisition is very important. Did they have the education? Did they have the resources with their family and the medical interventions and support to allow them to acquire language and acquire a dominant language? So with a hearing child, most of the time, if a hearing child is upset and they just don't want to talk, they are still listening while you're asking them the question. So if I'm giving choices to say, are you mad at your mom? Are you mad at your dad? Are you mad at your brothers? They're actually understanding what I'm saying. The other difference is that the parent would have been able to have that conversation with them at home and in the session with me, and they would have been able to communicate. And as a therapist, you would have been able to facilitate a direct communication with the parent and the child to strengthen that relationship, to help them problem solve, and the parent support the child through the feelings. When the parent doesn't sign in the same communication mode as the child, then the parent does not have that ability. And so the child is feeling more frustrated and they're shutting down because they're like, when I go home, there's nobody that understands how I feel. So that's the major difference. So the client's communication modes. There are a variety of communication modes, and so when a deaf or hard of hearing client comes into your office, do not assume what their communication mode is. You need to ask them what they prefer. So some individuals use American Sign Language, and so you would use a sign language interpreter. Also, some deaf and hard of hearing individuals grew up using signed exact English. If this is the case, they usually will indicate that. And when you request an interpreter, you would ask for someone that knows signed exact English, or the interpreter will ask the client which do they prefer, American Sign Language or signed exact English. Deaf and hard of hearing clients that we call oral deaf, or they identify as being an oral deaf person, may read lips. Do not assume that all deaf and hard of hearing individuals read lips. Reading lips is a very specialized skill, but it does not mean that you can read every word of the English language. There are thousands of words in the English language, and not all of them can be seen on the lips, and some things will interfere with that. Sometimes it's mustaches, sometimes it's just the different facial features or things like that. It also depends on if you're facing the person, if you're turned around. So that is not a reliable means of communication, even if the person says they can read lips. Another communication mode that some deaf and hard of hearing individuals may use is skewed speech. If that is the case, then that person would let you know that, and you would ask them what communication mode would they prefer. If they would prefer written communication or trying to find someone that can communicate in that mode, although those means are very hard to find. Also, there are two other modes of communication that also occur. Home signs are used with some deaf and hard of hearing clients that may not have received education. They may have been in a rural area where education for deaf and hard of hearing people may not have been easily accessible. So the family made up their own signs or gestures, but they're not an established language such as American Sign Language. The person may be older and not have received that education and been able to acquire a actual intact language communication mode. The other thing is to consider if you have a deaf or hard of hearing client from a different country. So if someone has just moved to the U.S., they may not use American Sign Language as of yet. They may know a different kind of sign language, so Mexican Sign Language. All sign languages are not universal. They're different in each country. And so if that is the case, you can talk to the person, ask them what sign language they use if it's from another country. You can ask the agency if they have someone familiar, or you can use what's called a certified deaf interpreter in addition to a certified sign language interpreter to help with communication and to help facilitate the mental health process and services. So now let's talk a little bit about the therapeutic relationship. How does this impact the therapeutic relationship between you and the deaf and hard of hearing client? You have to think about what is your theoretical framework. What techniques in therapy do you believe in and that you feel most comfortable utilizing? Whatever those are, you may need to adjust them when you're using them, the deaf and hard client, and you may have to also refer them to a different therapist if you do not feel competent or qualified to provide the kind of services that the deaf and hard of hearing person would most benefit from. The other thing to always keep in mind is that misdiagnosis of mental health illness also frequently occurs. So because of the way that deaf and hard of hearing people and clients communicate, sometimes may appear as symptoms of a mental illness. Sometimes in sign language, when someone becomes very upset, they may look agitated, or they may be really emphasizing their point and feelings. That does not mean they have a mental illness. In addition, previously we talked about reading comprehension and writing skills on some of the questionnaires and depression inventories and mental health screeners that we often provide clients. They may have misunderstood what an English word meant and may have put down the wrong answer. So it's very important to double check some of the questions and answers and really do a total assessment and have a conversation with the client to make sure that you're properly diagnosing the client. The other thing to think about is schema and background knowledge. So for instance, skiing. If you talk to someone about skiing and they've never been skiing before, they may not know what that is. Even if an interpreter was to just sign skiing, the deaf or hard of hearing client may know what that is, they may not. You have to think about that not all concepts the person may know, but providing a simple explanation or a picture, they may know after that. So just make sure you're checking for understanding. And the last thing to think about is trust. You have to also remember that they're coming into your environment. They may not trust you as a hearing person or as a person that they may have never met or may not know. So please give time for the therapeutic relationship to grow and for trust to be established. So this, as we wrap up and conclude, these are just some tips that you should remember. Every deaf and hard of hearing client is different. The communication modes are different that they may use. So don't assume that any one deaf or hard of hearing person is exactly alike. Remember, level of functioning languages could be functional communication into very advanced and complex intact language. Also remember the relationship with their family. It could be a very involved, supportive family that accepted their hearing loss and supported them and helped support their deaf and hard of hearing identity, or they could have had a very opposite experience and they might have felt very isolated or disconnected. There might be additional disabilities that may also be presenting. And then also remember the history of abuse or trauma may also impact deaf and hard of hearing clients differently and significantly. So these are some other things that you should also keep in mind. The deaf and hard of hearing client may or may not be familiar with terms that we use in the mental health setting. Like we often will say on a scale of 1 to 10, rate something on the screeners or questions that we ask, or how when we ask about somebody's mood or their feelings, or a scale 1 to 5. We may need to take a step back, take a minute and explain what scales 1 to 10 mean, or scales 1 to 5, what that actually means, so that the client can accurately answer the questions and rate their feelings of depression, anxiety, and moods correctly. The other things is just mental health diagnoses terms in general, like bipolar, schizophrenia, hallucinations. When you're throwing out those terms, if the person does not know what they are, please take the time to explain those. Also, words to describe their feelings and moods. As we talked about before, basic feelings like happy, sad, and mad are often known, but things like frustrated, overwhelmed, or conflicted, or disappointed, those feelings may not have been explored yet. So taking the time to explain that and to really support that client in exploring the range of feelings and moods and difficulties they may be experiencing. And then also just how to describe abuse or trauma if they have that experience. Also, please remember your session may take longer than normal, especially initially when you're with a deaf and hard of hearing client. This is something that I always keep in mind and also struggle with a lot of times, is because when you are assessing a client for the first time or the first few times, to get the background information, to understand what they're experiencing, and to best help support them, it may take more than 45 minutes or your normal hour appointment. So just keep that in mind and make sure you allow for extra time or for extra sessions. The other thing to keep in mind is when you're using an interpreter, it might also require extra time for your sessions. And then in general, the progress made in therapy may take a little longer than expected, so make sure you have a number of sessions that will allow for that. I would say be very patient. Make sure to make a safe space, because sometimes you are the first space that deaf or hard of hearing person has had to just be mad and vent and get all of their feelings out. And sometimes you just have to listen and let them talk, and however they want to do that. So your treatment goals may not exactly get done in the exact order you expected them to, because that person needed to express how they felt, and let them tell their story. That is the number one thing. Let them choose what they want to work on. Let them feel empowered to tell their story of their own experiences. My contact information is listed, and that summarizes the guide to supporting mental health clinicians and providing services to deaf and hard of hearing clients.